Good morning, everyone. Today we are here to discuss the topic Parkinsonism. First, I am going to teach to you what is Parkinsonism. Then, I will explain about the introduction and definition of Parkinsonism. Then, we will discuss what are the etiology, pathology, clinical manifestations, and finally, I am going to share with you about what are the investigation and management of Parkinsonism. First, introduction. Parkinsonism is otherwise known as Parkinson's disease. Parkinson's disease is a degenerative disorder of the central nervous system that often impairs the sufferer's motor skills, speech, and other functions. The conditions were popularly known as shaking palsy. The term Parkinsonism is used for symptoms of tremor, stiffness, and slowing of movement caused by loss of dopamine. Next, the definition of Parkinsonism. It is a slowly progressing disease involving degeneration of cells in basal ganglia and substantia nigra leading to deficit of dopamine. Dopamine is a neurotransmitter which produces gradual weakness of the voluntary movement with muscular rigidity, tremors, impairment in the balance, and automatic reactions. Under microscopic examination, the damaged neurons in the substantia nigra show a round inclusion called Lewy body in Parkinson's disease. Hence, sometimes it is also called Lewy body Parkinson's disease or simply Lewy body disease. Next, the etiology of Parkinsonism. Idiopathic. Idiopathic means don't know, we actually don't know about what is the reason for Parkinsonism. Next, the multi-infarct atherosclerosis, viral infection, chemical toxicity, drug-induced Parkinsonism, secondary to Alzheimer's disease, Wilson's disease, metabolic causes, traumatic. Next, the pathology of Parkinsonism. Due to degeneration of cells in basal ganglia and substantia nigra, the dopamine level, which is a neurotransmitter responsible for coordination of normal movement, is decreased. Because of decrease in the dopamine receptors in the basal ganglia circuit called striatum are not adequately stimulated. This causes decreased or absent inhibitory influence on the cholinergic pathway, causing excessive excitation of the extrapyramidal system. This impairment leads to rigidity, bradykinesia, tremors, and disorders of gait and balance. It is a picture of Parkinson disease patient. Here are some symptoms of Parkinson disease. The Parkinson patient has stooped posture, masked face, back rigidity, forward tilt of trunk, reduced arm swing, flexed elbows and wrist, hand tremor, tremors in the legs, slightly flexed hip and knees, shuffling or short stepped gait. The clinical manifestations of Parkinsonism. Uh, First, the motor symptoms. Tremor. What is tremor? The involuntary oscillation of body parts at frequency ranging from 3.5 to 7 Hz. It is most commonly a rest tremor. First, what is the rest tremor? The tremors becomes maximal when the limb is at rest and disappearing with voluntary movement and sleep. The tremors may be present when holding up the outstretched arms, which are known as postural or sustensional tremors. The tremors may be present when performing various movements, which are known as action tremors. If the tremor is only felt by the patient and not seen by the examiner, it is called internal tremor. Next, pronation supination tremor is described as pill rolling. Next, about rigidity. It is an increased resistance when stretching a muscle passively throughout the range of motion. It is the contraction of agonist and antagonist muscles due to increase in the supraspinal influences leading to increased tone in agonist and antagonist muscle. Rigidity can involve all parts of the body and be symmetrical or asymmetrical. The common forms of rigidity are lead pipe and cogwheel. What is lead pipe? The rigidity where the resistance is constant and uniform. And the cogwheel means the rigidity where the resistance is intermittent but uniform. Next, the bradykinesia and akinesia. Bradykinesia means it is slowing in initiating the voluntary movement. There is decreased amplitude and intensity of contraction. The patient usually complains difficulty in rolling in the bed and fine motor coordination like buttoning a shirt. The bradykinesia may be due to inability or deficiency of the basal ganglia to integrate sensory information. On EMG examination, there will be time lapse between the actual recruitment of motor units, firing by motor units, and initiation of movement. Then, what is akinesia? Akinesia is the inability to initiate a voluntary movement and is attributed to severe rigidity. Bradykinesia means the slowness of movements, and akinesia is the absence of movements. Postural disturbances. What are the postural disturbances present in the Parkinsonism patient? Camptochomia. Camptochomia is the means all body structures in flexed posture, and there is scoliosis, shuffling gait, turning en bloc, fascination, and dystonia. Next, the speech and swallowing disturbances: hypophonia, drooling, dysphagia, dysarthria. Hypophonia, drooling, dysphagia, dysarthria. Other motor symptoms are fatigue, hypomimia. What is the hypomimia means? A mask-like face. Difficulty in rolling in bed or rising from a seated position. Micrographia, small, cramped handwriting. Impaired fine motor dexterity and motor coordination. Impaired gross motor coordination. Akathisia, an unpleasant desire to move. Re-emergence of primitive reflexes. Next, the investigations of Parkinsonism. SPECT, single photon emission computed tomography, is an investigation method to recognize what is Parkinsonism. Next, transcranial ultrasound, routine blood investigations, and clinical assays. Then, management. First, the medical management. The following drugs are available for the Parkinsonism patient: levodopa and carbidopa, dopamine agonists, COMT inhibitors, amantadine, anticholinergics, monoamine oxidase inhibitors, and selaginil. What are the surgical management for Parkinsonism? Thalamotomy, pallidotomy, deep brain stimulation surgery. These are about the Parkinsonism. Thank you.